It just hurts like deep, like all the way in and just everywhere.
I received a consult request while I was in my office seeing patients on Friday afternoon that there was a young woman, 35-year-old woman, who had essentially spontaneously gone blind in 2 days. As a diagnostician of dermatology, I specialize in decoding the mysteries of rare and complex skin conditions. A skin finding may actually be the sign of internal pathology. I'm here to reveal it as your Skintellagent. I received a consult request while I was in my office seeing patients on Friday afternoon that there was a young woman, 35-year-old woman, who had essentially spontaneously gone blind in 2 days. And the only thing that led up to her visual defect was that she had had a painful progressive rash for several days prior that ultimately led up and was still continuing to progress. So, Alyssa, we met several days ago. I'm Dr. Ackerman. I'm the dermatologist that was here Friday night. And I want to talk to you a little bit about what's happened since then. When I met you Friday evening, it was, if I recall correctly, over the preceding maybe 2 days, you had gone from having some spotty vision loss to then, in 2 days, losing all of your vision. You were just telling me, I said, you look like you're in pain. Can you tell me what's hurting?
It just hurts like deep, like all the way in and just everywhere, and it's like a low, long ache that doesn't go away.
Okay.
When you look in her fundus, you get a clear look of essentially venous stasis. You get segmenting of the venous system with edema around the optic nerve, and her more on the left compared to the right. And so it certainly indicates something that would be very consistent with vasculitis.
Describe to me what you were or were not seeing. I mean, were you able to see light or shadows or anything at all on Friday?
No, but at that point it was absolute zero. It was pure black everywhere. I had a really bad rash on my legs and my arms that was very, very painful. And that was primarily the most of my pain was coming from that. And I was very, very cold. I could not get and keep warm, and my temperatures were jumping back and forth. And then the vision loss was the main other thing. Those 3 things were like all together, making it very difficult.
Fortunately, we were all convening on Alyssa's room. You know, the rheumatology team was there, the neurology team was there, and the ophthalmologist had just come. So we were able to talk amongst ourselves about what we really thought was going on, and I think, in truth, they were relying a lot on myself and what I was able to lend to this equation. You know, what was the skin telling us that had preceded the onset of blindness? Right now, the new finding that did come about that we have to investigate further is that her white blood cell count continues to drop. And it continues to drop now by an amount that's significant that we're bringing hematology on board. We've sort of been watching the trend, and it's been a steady, slow decline, but it blipped a little bit yesterday, and one of the cell lines in particular that's low could lead her to being at risk for other infections, and as well could suggest to us even maybe the cause of why all of this is happening. I knew right away after seeing some images of what her skin looked like that this was going to require a biopsy for a definitive diagnosis, but that in its appearance, at least, it looked like this might be a vasculitic process. We made the decision to start high-dose IV solumedrol, which is a potent steroid. We gave her 500 milligrams IV that night, along with covering for various different infections that might be responsible for her ailment. We sort of went broad, recognizing that wanting to do no harm. We needed to make a decision, and yet we needed to also protect her against the risks of that decision in particular. Alyssa's case has continued to unfold, and the most recent discovery is that the source of this vasculitis is reactive, and it's reactive to her recurrent breast cancer. So the rash actually started the presentation of her illness, and within a few days she had gone blind. Ultimately, that's when she presented to the hospital. I was running to the floor to get her blanket, so I heard that someone had left something behind, so put out your hands. What does this feel like?
Yay, it's my blanket! Yay.
Right on. So we're a month later now. That was actually literally just a month ago. A lot's happened. You got through your hospital course beautifully. I think everybody felt very confident with you getting to depart the hospital, that you had certainly left the hospital in a better place than when you came in.
My skin has been amazing ever since everything cleared up. I've not really had any complaints or anything as far as anything that I've noticed or had any problems recurring with the skin. Overall, any of the pain and anything that I had started out with in the very beginning seems to have subsided and gone. And with as far as my vision, I still have noticed I get little bits of progress and try to focus on that when I do, so that I can keep looking forward to what I do maintain and what I do have. I actually just the other day started realizing or started seeing yellow, 2 days ago. I've not noticed that I've been able to pick up the color yellow before. I do know that I started out with blue, and then red started coming through, and now yellow.
I remember the blue in the hospital because we had blue gloves, and you could...
I came home and Hayden's voice had changed, and I was only gone for 2 weeks, and his voice had already changed, and Jet had already grown. I could put my arms around him, and he was just so much bigger. So it was every day that I'm here with them, I'm thankful for all the little things that I'm even noticing now that I probably wasn't even able to notice when I did have my sight. You kind of skip past some of that as when things get hectic and busy in your lives, and I stopped even seeing those little bit tiny changes all the time, and now I'm noticing them again, which is...
They smell differently.
It helps me really appreciate everything again.
Yeah.
So I'm finding different ways to adapt and learn how to navigate around whatever obstacle I'm coming across, because I don't really want to accept the obstacle. I have to find a way to fix it.
That's great.
So
creative. I think that too is probably coming to life in a different way, right? Being forced into it, whatever, you're getting there.
Exactly.
It's great.
I have been on a cancer medication since 2021, when we found out that it had gone to the bones, and I get my scans every 6 months, and in the scans that they did last year and then the scans that they did this year, they've seen that the cancer spots have actually gotten smaller. I remind myself that the kids are worth it, and that's what I'm fighting for. So they're just amazing. So
bringing her back to circle through kind of where she's been and where her disease state is, and see her living, telling me about her kids, and they're involved in soccer and involved in dance and involved in acting and so many things that she gets to enjoy as a parent.